I call on Angela Constance.
Presiding Officer, this Government is determined to ensure the maternity services provided across our country meet the highest of standards for all women and their families. The core principles of safety and choice must remain at the very heart of this. I know members will share my deep concern about recent reports on maternity services, including last week's Healthcare Improvement Scotland inspection report on the Queen Elizabeth University Hospital's maternity services. And my statement will respond to these findings and set out the further action we will now take nationally, including through an independent review of maternity services. I know that for women and their families, pregnancy and birth can be both exciting and worrying. Giving birth in Scotland is, in the vast majority of cases, very safe, and our NHS staff are highly skilled. Any woman who is pregnant should always access care. Women generally report positive experiences. The National Childbirth Trust recent study From Expectation to Reality found that 87% of surveyed new mums in Scotland said they received good quality care. Today's Embrace UK audit report on UK perinatal deaths of babies born in 2024 shows Scotland had the lowest rate of all 4 UK nations. That said, I have heard the concerns shared by women, their families and members of this chamber, and one poor experience is one too many. Care must be safe, compassionate and of the highest quality, regardless of where or when women give birth. Ministers have already laid some important groundwork needed to address the challenges facing maternity services, but it's clear much more remains to be done. Last year, Healthcare Improvement Scotland began a rigorous programme of inspections of maternity units instigated by this Government. These inspections are independent of Government and are conducted wholly unannounced. Last week's HIS report into the Queen Elizabeth University Hospital identified serious issues, particularly in relation to women's experience of birth and access to timely, personalised care. Inspectors reported delays in triaging to labour wards and instances of failures to provide interpretation services where they were needed. And I find these issues unacceptable, and I have made that very clear to the Chief Executive of NHS Greater Glasgow and Clyde. And I expect all of Healthcare Improvement Scotland's 26 requirements to be taken forward urgently, and Ministers will be meeting the Board's Chief Executive again before recess to review progress. Whilst the report identifies the failures, it also highlights kind care delivered to women, babies and their families, demonstrating the dedication of maternity staff. And I will shortly meet Jackie Lambert, Director of the Royal College of Midwives, to discuss the concerns of the workforce and to reiterate my thanks for the exceptional dedication of midwives. Members will also recall his inspection report of the Royal Infirmary Edinburgh maternity unit last year. And progress within NHS Lothian is positive. 24 of the 26 HIS requirements have been delivered, with the Board launching a maternity culture charter and recruiting new staff. However, NHS Lothian maternity services remain escalated under the framework we have for supervision, and will continue to work with the Board to ensure they meet all of HIS's requirements and recommendations. With 7 of the 18 HIS inspections completed, common themes are emerging. These include inconsistent approaches to maternity triage, delays in induction of labour, workforce pressures, concerns around governance and culture, and failures to consistently meet core mandatory training requirements. And each of the boards inspected by HIS has submitted a detailed action plan setting out how they will address the issues identified, and they will be held to account for delivering on those commitments. It is clear, nonetheless, that decisive national action is needed to tackle the issues we are seeing again and again in different parts of the country. And that work has already begun. Firstly, we commissioned HIS to develop standards describing the level of service expected in every maternity unit. These were published in March, and HIS will incorporate the new standards into their inspection programme from September. Last year, we published an action plan to address racialised health inequalities, and this provides boards with clear actions to take to improve the care provided in perinatal services. We have developed a delivery framework for miscarriage care to make sure women and their families receive the compassionate care they need at the right time in settings that meet their needs. Our triage working group is producing a target operating model that describes how maternity triage services should look in small, medium and large units and in rural and urban communities. Work has also been taken forward to support the sustainability of the maternity workforce through our Nursing and Midwifery Task Force, including improving recruitment pathways, retention and workforce wellbeing. And Minister Marie Todd will take forward work to develop a rural midwifery apprenticeship. While those actions are important, they will not be sufficient, and that is why we have committed to an independent review of maternity services in Scotland. And this review will draw on inspection findings, but we cannot wait for HIS's programme of inspections to conclude next year before it gets underway. That is why today I have published the core principles of the review, and I will outline these to members now. Firstly, the review will consider whether we have the right maternity services in place to meet the changing needs of women and families. Women are increasingly having children later in life, and more women are entering pregnancy with complex health needs. And these factors can have a significant impact on the care required during pregnancy and birth. And this review will provide a strategic assessment of need that will help us match our services to our population. The review will be forward-looking and consider service sustainability, taking account of workforce culture, safety, quality and equity of access. The review will consider maternity services in rural and island areas and the experiences of women living there. And I have heard very clearly, particularly from Marie Todd, David Green, Finlay Carson and Laura Mitchell, of the strength of feeling in Caithness, Wigtonshire and Elgin. And I know progress has been made in meeting our commitment to Dr Brace Hospital in Elgin, and I want to ensure that that progress continues. This review will look at the experiences of women in Caithness, Wigtonshire and Elgin, and in other rural and island communities. The review will consider inequalities in outcomes, including the higher maternal mortality rates experienced by Black and Asian women, and will assess whether current work to tackle racialised inequalities is achieving the impact required. And this will be informed by the voices of Black and Asian women. Lastly, the review will consider how NHS boards engage with their local communities on the decisions that they make about maternity services, and I know that this has been a key issue raised by Scotland's Patient Safety Commissioner. Presiding Officer, this work will demand an experienced and trusted chair, and I am therefore very pleased to announce that this review will be chaired by Professor Christine McCourt. Christine McCourt is Professor of Maternal and Child Health at City St George's, University of London. Her wide-ranging expertise includes focusing on the experience of women, informed choice in care, place of birth, induction of labour, group care and continuity of carer, and on approaches to improve equity, quality and safety in care. She is a trusted leader in the UK in maternal health and is well placed to lead the transformation that we need to see. Professor McCourt will engage with women, families, patient groups, clinicians, midwives, nurses and the wider maternity workforce across Scotland, including in Caithness and Wigtonshire. It is essential that the voices of those receiving and delivering care are heard directly through this process. I will also ask Professor McCourt to examine service models and make robust evidence-based recommendations on the best possible clinical pathways to ensure women are safe when they give birth and that their needs and those of their families are met. Pace is essential, and I expect the review to be commenced after summer and be completed within 9 months, and we will publish a more detailed scope and terms of reference in due course. And to ensure that Parliament is fully involved in this work, I will ask Professor McCourt to host a cross-party meeting before she begins the review. Presiding Officer, I want to close by providing reassurance today to women that they will be heard. Welcoming a new arrival to the world is the most precious and special moment, and women must be able to trust the services being provided to them. And this independent review is about ensuring women can have the confidence that this government will take swift action where it is needed. This not only delivers on our 100 days commitment, but importantly will deliver real and tangible change for women, their babies and their families. Thank you.
The Cabinet Secretary will now take questions on the issues raised in the statement. I intend to allow around 20 minutes for questions, after which we will move on to the next item of business. It would be helpful if members who wish to ask a question were to press the request to speak buttons now. I've had indications from 13 members that they wish to ask a question to the Cabinet Secretary, and to enable all of those questions to be put and to be answered, this will require both questions and answers to be brief. Jackie Bailey.
Thank you, Presiding Officer. Can I welcome the Cabinet Secretary's statement and welcome the appointment of Professor Christine McCourt. She has her work cut out for her. Inspections have revealed the significant delays for women waiting to be induced in Glasgow, others forced to travel 100 miles to give birth in Caithness, and shortages of midwives in Lothian as examples. Parents who lost babies, though, are frustrated by the lack of transparency. Promises were made previously that parents like Julie Keegan, who lost her baby boy, and Laurie Quate, who lost both his wife and unborn child, would be part of the task force. So can I ask the Cabinet Secretary why they've not been involved? And only this week we learned of further delays to the opening of the Baird Family Hospital, which of course provides maternity services. It's 7 years late. And then there's the downgrading of the award-winning Wishaw Neonatal Unit, and consideration of neonatal services appears to have been dropped. It would be helpful to know if the Cabinet Secretary would reconsider. And finally, Presiding Officer, in my constituency, midwives and expectant mothers are concerned by reports that triage calls currently dealt with by their local hospital, the Vale of Leven, could be centralised. So what steps will the Minister take to ensure that women giving birth receive safe, high-quality care wherever they are in Scotland?
Cabinet Secretary.
Presiding Officer, I'll do my best to answer those points in turn and also try and achieve brevity. Jackie Bailey says that Professor McCourt has her work cut out for her. Can I just suggest that we all have our work cut out for her? Because time doesn't stand still for any of us. And where there are issues, I hope this chamber and Miss Bailey knows I will always be candid and direct. And if I need to lift the lid on something, I will indeed do that. And transparency for families is absolutely crucial. I have been concerned by reports that I have read with respect to serious adverse reviews. The issue around these reports that's at the very heart of them is quality and timing. These reports have to be done continuously, they must involve families, and they must be of a good quality, because they facilitate learning for the future. In terms of Baird and Anchor issues, we want those services to be open as soon as possible, but they need to be safe before they're open, and I think we have all learned those lessons. In terms of Wishaw Neonatal, can I just start by saying I recognise the tension here, that if you've got a very sick baby and that wee baby is not being cared for in the hospital closest to you, I understand well and truly the distress that that will cause. But I also understand what we have to do to save young lives. And based on clinical advice, with the support of organisations like Bliss, we have moved, or are in the process of moving, to a model that has safety at its heart. And I'm happy to, of course, discuss that forward. The terms of reference have still to be published. And, of course, you wouldn't publish the terms of reference before a chair was appointed, because a chair has a crucial role in that, because they are indeed independent.
Helen McDade.
Thank you, Deputy Presiding Officer. I thank the Minister for her statement and welcome the independent review. As someone who stood on it for this Parliament once before on Save Local Hospitals, Dunfermline, Perth, Stirling. I'm interested to see how things have gone on in 20 years. And one of the key issues remains the same, which is about workforce. So in Caithness and other areas, it's often a death by 1,000 cuts. First, you don't have the medical staff, you don't have housing for them, so they don't want to come. Then you have a less problem with midwives, you maybe don't have midwives. And then you say anybody who's anything other than a low risk has to be moved, and so on it goes. And I won't speak about the problems, Jackie and others have often mentioned it, but what are the specific steps that the Scottish Government is taking to increase recruitment and retention of midwives?
Cabinet Secretary, and members must refer to other members by their full names.
Thank you, Presiding Officer. Can I just say for the record in terms of qualified midwives that over the past 10 years there's been a 13% increase in qualified midwives, and that equates to a whole-time equivalent of just under 318. But nonetheless, there are significant workforce issues to be addressed. As I said, I'll be meeting with the Royal College later today. Minister Marie Todd will continue to be involved in the Nursing and Midwifery Task Force, which has been designed to specifically look at those workforce issues, because recruitment, particularly in rural areas, can be a challenge, and we need to ensure that we're also retaining those who join this very important vacation. So there's work to do, but I want to assure Ms McDade that we are well and truly on the journey.
Laura Mitchell.
Thank you, Presiding Officer, and I thank the Cabinet Secretary for her statement. The Cabinet Secretary will be aware that it is now 8 years since NHS Grampian downgraded maternity services at Dr Gray's Hospital. Restoration of a consultant-led service has been supported by the Scottish Government, and the project team are now undertaking the most challenging phase of work to recruit key clinicians to restore our full obstetrics service. I welcome the reference to Elgin in the Cabinet Secretary's statement, and I ask that she confirm the review will not impact the Scottish Government's commitment to a consultant-led service in Murray, and that the Government will do all it can to support the project team as it continues its work to rebuild services at Dr Gray's.
Cabinet Secretary.
Presiding Officer, as I said in my statement, we remain committed to supporting the return of obstetric maternity services to Dr Gray's Hospital. And indeed, since 2023, we have invested with NHS Grampian to support that return, and indeed in this financial year there's a further £6.5 million investment. Since 2024, NHS Grampian have made progress around obstetric daycare, antenatal scanning services, and are also performing elective daytime caesareans. There, of course, is further work to be done, and that hinges around ongoing recruitment.
Kayleigh Kinross O'Neill.
Thank you, Deputy Presiding Officer, and can I thank the Cabinet Secretary for her statement, and I'd like to also echo your appreciation and sincere thanks to the exceptional dedication of midwives. When they start their journey as midwifery students, there are often barriers of staying in the sector due to the cost of living and studying. So I'd like to ask, can you confirm if this review would also look at paying midwifery students whilst they learn?
Cabinet Minister.
Presiding Officer, the purpose of the Midwifery and Nursing Task Force is to look at these issues. I mentioned earlier the work that Marie Todd will be leading around apprenticeships, but she raises a very interesting point about earn as you learn routes into the profession. In a former ministerial role, I was the Minister for Youth Employment, so I'm very committed to vocational learning and models, adapted otherwise, in and around what we've learnt from the success of apprenticeship-type models.
Megan Gallagher.
Thank you, Presiding Officer. There's been 3 reviews over the last 10 years regarding maternity and neonatal services, and I just don't believe that there's any joined-up thinking from this government in relation to its approach and how it's going to improve these services for mums and their babies. But one issue that I do want to raise today is in relation to the number of beds available for parents in neonatal wards. The work that was undertaken by Bliss Scotland shows that for every 10 children needing specialised care, there's only 1 bed for parents to stay overnight. Now, I worked with the previous minister on this, and I'm willing to work with the Cabinet Secretary on this issue. So can she give an update today on the number of beds that are currently available for parents, and will she ensure that this is changed positively to make sure that parents can stay with their babies who are needing specialised care?
Cabinet Secretary.
Presiding Officer, Ms Gallagher makes an important point about keeping mothers with their babies, irrespective of the health needs of the child, and we want to do that as much as is conceivably possible, and I would be delighted to work with Ms Gallagher on that, and I will follow up the very specific question that she has asked about number of beds and in terms of their availability and where are they. I think what I would say will be different around this review is that it is on the back of 7 now Healthcare Improvement Scotland maternity inspections, and there are broad themes. And the work of both the Nursing and Midwifery Task Force, but also the Midwifery and Neonatal Task Force will be very important to ensure that the review can build upon that. And I am absolutely confident that we have an excellent and outstanding chair to lead this work, who will be open to engaging with parliamentarians, but most important of all, the communities and all of the communities that we all seek to represent.
David Green, to be followed by Alex Carr. David Green.
Thank you, Deputy Presiding Officer. The Liberal Democrats have long called for an independent review, so I welcome the appointment of Professor McCourt as an independent chair. It is imperative that local campaigners and those with lived experience are fully engaged, including Billy Rennie's constituent, Laurie Mark Quaid, who had a previous commitment to be involved with the task force, but that hasn't happened to date. So will the Cabinet Secretary also recommend to Professor McCourt to meet with Caithness Health Action Team and experience first-hand that 100-mile-plus journey that mums in the far north are forced to make? And can she also clarify whether the review will examine restoring consultant-led maternity services in Caithness?
Cabinet Secretary.
Presiding Officer, this of course is an independent review with an independent chair, but I do hope it is helpful that the principles that I have published today will give at least some reassurance until the review has been set up and established. In terms of the existing nursing and neonatal, midwifery and neonatal task force, some of that work will be paused, and what the proposition, subject to consultation with the chair, is that there is a panel to advise her. But what I am clear about, that any review, as well as being independent, has to engage with the communities affected, and that specifically includes Caithness, it includes other rural communities as well. And you'll also note in my statement the issue in and around clinical pathways, as well as maternity triage, which will be important. But this is a very comprehensive independent review for all of Scotland, and is inclusive of the communities that many of our members here today represent.
Alex Carr, to be followed by Donald McKinnon. Alex Carr.
Thank you, Deputy Presiding Officer, and thanks to the Cabinet Secretary for this statement. It is vital that everybody planning for a family in Scotland should feel confident they will have a positive and safe experience of maternity care, where their choices are respected and supported. Therefore, I was delighted to see the Cabinet Secretary talk about equity of access, particularly around rural areas, which includes many communities in my constituency. Can the Cabinet Secretary say any more about the plans to improve that equity of access for expectant families across the country?
Cabinet Secretary.
Presiding Officer, the member raises a crucial point about equity. and equity is an issue with regards to access, and of course we've heard about some of these very long journeys that birthing mothers are travelling across Scotland. But equity is also important to consider the impact of debt deprivation, and if I just give one or two examples of that. Women from the most deprived communities are more likely to have complex health issues, more likely to have diabetes, they're more likely to have a preterm baby, and their baby is more likely to be small for gestational age. So this is a comprehensive independent review, and inequity in all its forms will be at the heart of it.
Donald McKinnon, to be followed by Jenny Minto. Donald McKinnon.
Thank you, Presiding Officer, and can I thank the Cabinet Secretary for her statement. Western Isles Hospital Maternity Care received an excellent report from an inspection earlier this year, showing staff are doing a great job providing compassionate and responsive care to women and their families. However, the report from Healthcare Improvement Scotland also stated that recruiting and retaining staff is a concern, with housing a key issue. What role does the Scottish Government see the Key Worker Housing Fund having in ensuring maternity care in our islands remains excellent?
Cabinet Secretary.
Presiding Officer, the member makes an important pragmatic point, and that's why we need all our services to be joined up, and it's why we need every portfolio in government to be joined up, because the housing fund for key workers is absolutely imperative, because I think we all know of the recruitment and retention challenges, particularly in our rural communities, and I of course appreciate that there are additional challenges with our island communities.
Jenny Minto, to be followed by Singer Beresford. Jenny Minto.
Thank you, Presiding Officer. I too would like to associate myself with the Cabinet Secretary's comments with respect to the staff working in maternity services, especially those in Argyll and Bute. And it's a follow-on really question from Donald McKinnon's. To ensure the current 24-hour midwife-led community service is maintained in places like Argyll and Bute, staffing levels cannot be reduced. What discussions are the Scottish Government having with health boards and health and social care partnerships to ensure there is appropriate staff funding to improve maternity services across Scotland, and especially in rural constituencies like Argyll and Bute? And also how important, how these very important rural and island voices are included in the maternity review?
Cabinet Secretary.
Presiding Officer, I'm grateful to Ms Minto for her question. I know she has done and will continue to do great work and champion the needs and the healthcare needs of women, and also she'll continue to be a strong voice for rural Scotland. I'm sure the member will be aware that local authorities and health and social care partnerships are responsible for planning and delivering services that meet local needs. However, I'd also want to be very clear again that safe and effective care for women using maternity services is of the utmost importance. And I do recognise the challenges faced by women in rural areas of Scotland, including those Argyll and Bute. And with another hat I used to wear, I was the Resilience Minister, so I have become intimately familiar with some of the weather challenges, whether it's in Argyll and Bute or indeed in Caithness. So I can appreciate some of the logistical challenges for public services and indeed emergency services. But I would like to point out that we have provided a record £17.5 billion to health boards, and since 2018 we have provided over £34 million to invest essentially in maternity and neonatal services alone.
Singer Beresford, to be followed by Claire Hohe. Singer Beresford.
Thank you, Presiding Officer, and can I thank the Cabinet Secretary for her statement. I appreciate the attempts outlined by the Cabinet Secretary to address some of the issues facing maternity care in Scotland. But can I ask, while we wait for an outcome of the new National Review of Maternity Services, that action will be taken to help the expectant mothers currently having to travel 75 miles to access maternity care since the Galloway Community Hospital maternity wing was shut down?
Cabinet Secretary.
Presiding Officer, I am becoming aware of the history of the range of local issues in different parts of Scotland, including the south west of Scotland. And while we can't turn back time, we do have to look forward and address all the issues that are being wrestled with, both in terms of choice, but also safety also access and also equity. And that's equity in terms of, irrespective of where a woman stays, but also in terms of the other challenges that they may face in their life. And the purpose of this review is really to build on the previous work done. We're not going back to reinvent the wheel, but really to get some impetus and not wait until the end of the cycle of healthcare improvement reports have been completed. The 8th report is due to be published soon. There will be 18 reports in total. But we do need those healthcare improvement Scotland reports, because they are indeed shining a light. They'll shine a light on the good practice, the compassionate care, the value of midwives in this country, but they are also shining a light on where improvements must be made. And the job of the task force will be to work at pace and to implement change that I hope that we can all get behind.
Claire Haughey, to be followed by Cara McKee. Claire Haughey.
Thank you, Presiding Officer. And I remind members of my register of interests. I hold a bank nurse contract with NHS Greater Glasgow and Clyde. The Queen Elizabeth University Hospital in Glasgow was recently ordered to make 26 improvements by Healthcare Improvement Scotland. Many of my Rutherglen and Cambuslang constituents access maternity care at or from the hospital. What reassurances can the Cabinet Secretary give my constituents that those improvements will happen and that their maternity care will be safe?
Cabinet Secretary.
Ms Hockey raises a point, Presiding Officer, that we do have to reassure women and women who are currently expecting a baby that they should be confident in accessing care and also recognising that it's a special time, but it can be a worrying time, and if things don't operate to plan, that there will be absolute transparency around that. And with that in mind, we always want to be encouraging women to access the care that they need. I intimated in my statement that I very quickly met with the Chief Executive of NHS Greater Glasgow and Clyde, and separate to that I met with Healthcare Improvement Scotland, because that was my way of cross-checking what the Chief Executive had thoroughly relayed to me about the progress that they had been making with their published action plan, about the additional investment in midwives, the work that they were doing to engage with their workforce, the work that they were doing to engage and address issues of culture, and also the issues around access to interpretation services, because that was something I specifically raised with the Chief Executive. Because I can't imagine that if English is not your first language, it must be quite frightening not being able to communicate your needs. And being able to communicate your needs and have your needs understood is a fundamental of care. And I did take the opportunity to engage with Healthcare Improvement Scotland, who were able to confirm very proactive leadership and ownership from the Chief Executive and the Board. And I can just assure the member, so that she can reassure her constituents, I will be following this through, myself and ministers, with further meetings. And of course we have a range of options available to us if progress doesn't continue as it currently is.
Cara McKee, to be followed by Zengani. Cara McKee.
I thank the Cabinet Secretary for her statement, and I welcome the commitment to work with Black and Asian women to inform the review. I'm sure the Cabinet Secretary will be aware of the shocking statistic that Black women are more than twice as likely as white women to die in pregnancy, childbirth or the postnatal period. Some of the women who engage with the review may have experienced significant trauma as a result of being racialised by maternity services. How will the Cabinet Secretary ensure that the review is trauma-informed and that there is sufficient emotional support available for those who take part?
Cabinet Secretary.
Presiding Officer, I am acutely aware of the Embrace UK maternity mortality stats, which are very sobering indeed. They show that there is a threefold difference in maternal mortality amongst black women as compared to white women, and the mortality rate amongst Asian women is a bit higher than white women also. And while we've got to recognise those disparities in outcomes that come from the audits and confidential inquiries that have taken place across the UK. So tackling racialised health inequalities is crucial. There has been work ongoing in that area. There is a maternal care action plan that was published February 25. And what I want to see as a priority is that work proceed. But the member will also note that racialised health inequalities is an important part of the brief for the chair of the new independent review.
Zengani.
Thank you, Presiding Officer. I welcome the Cabinet Secretary's statement today and the manifesto commitment made to an independent report into maternal mortality faced by Scotland's Black and Asian communities. It is essential that communities who face systemic barriers and bias are properly supported to ensure the best outcomes for everyone in Scotland. So can the Cabinet Secretary say any more about its expectations for this work and what it hopes to achieve with this commitment?
Cabinet Secretary.
Presiding Officer, I won't repeat what I said to the previous member, other than to reinforce that tackling racialised health inequalities is a priority. It is also a matter that I've engaged the Minister for Equalities, Sumita Kumar, on, and I've also been very clear with my health officials that this isn't just for the Health Department, that we need to be reaching out to different communities as well. And as I intimated, we did publish the Tackling Racialised Health Inequalities in Maternity Care Action Plan last year, and this had 14 actions to be addressed in the first instance, and activity is underway against all of those actions identified for local delivery by NHS boards in the action plan, and I can assure Mr Ghani that I'll continue to monitor the implementation of these through NHS board updates.
Apologies to members that I was unable to call. We now move on to the next business, and I'll allow the front benches to change.